Teachers are seeing a big increase in anxiety, depression, and suicidal tendencies in students right now. More than 150 schools in the St. Louis area are now using the same program as Rockwood. We take an in-depth look at how the CHADS program sets up a safety net for all students. Westminster Christian Academy in Town and Country recently began CHADS suicide prevention training for their middle and high school students for the first time. This year, counselors saw a change in the students' overall mental health.
Pretty soon into the school year, we saw anxiety and depression were really rising, quicker than we thought. It was just really noticeable in our overachieving students that hadn't been on our radar before, and we just realized how we need to address this.
Student leaders had reached out to counselors even before the pandemic, saying students wanted more conversations surrounding mental health. Upper school counselor John L. Patton could see a combination of issues piling up on students.
I also really want to name the pandemic and civil unrest, and before in August it was an upcoming election. So we have all these things that are really impacting our families, and when our families are impacted, our students are impacted.
The students are saying this is what they want. This is the real deal. And at CHADS, we're familiar with that. We give the real deal, and it's okay to have these conversations. Let me give you the terms and the vocabulary so that both you, your teacher, a staff member, a parent, someone in the community understands what you're saying.
CHADS teaches teens, parents, and teachers the signs of suicide, anxiety, and depression. The goal is to have a large safety net in place to help a struggling student. Some warning signs: talking or writing about suicide, feeling hopeless, increased substance abuse, and tunnel vision.
Tummy aches, headaches, sleeplessness, sleeping too much, overeating, more comfort eating, or not having appetite at all.
Other warning signs: history of depression, sudden sense of calm, and especially self-harm.
Amongst teens, it's high. Taking high risks, especially those older teens that are driving, drinking and driving or using drugs.
The goal is to open up an empathetic conversation with the teen.
Every single student that you could possibly see in your class can experience all of the symptoms at some point. When you come at it like that, then you've normalized it.
After the CHADS training, students do a self-ID, which then initiates a conversation with school counselors.
Do they need to contact other services or the parents? Do they need to have another conversation and bring in the teacher? We are in this together, and it works like that.
Westminster counselors saw an immediate response.
For the 9th grade class, we had about 9% of our students that checked that they wanted to come and speak with a counselor, and about 12% of our 11th graders.
CHADS started depression and suicide prevention training in the Ferguson-Florissant School District many years ago. The program runs from 5th grade through high school. Jennifer Lane, the school counselor coordinator, says it has saved students' lives. She remembers what a teacher told her after one of the trainings.
She said, I had 80 students that needed to see me, within a couple of days. And she said it was so overwhelming to see all of those kids. She said, but there were 5 that actually had legitimate plans, and they would never have been on my radar, and I would have never known about them had we not had this program.
CHADS receives grants that pay for prevention training in public schools, so it's free for them.
One of the things about the signs of suicide presentations is it normalizes the fact that it's okay to not be okay.
Lane tells me this year she saw a troubling trend: students Googling how to die by suicide, such as the fastest way to kill yourself.
I started tracking that specifically at the beginning of this school year, and we've had about 780 searches that were flagged, and 20% of those have been directly related to suicide.
Tracking the searches helped the district reach out to each student to make sure they were okay. Schools say it is time to start talking about suicide and not be afraid of the word.
It's a lie to think that if you say the word suicide, then you're giving that idea to somebody. No, you're not. What you're doing is you're giving them permission to talk so that they're seen and they're known and they're loved and they're not alone.
They will believe that they are truly seen and that they matter. That's the part that saves their lives.
CHADS now offers several of its programs virtually due to the pandemic, and that includes its SOS, Signs of Suicide program. SOS is the only evidence-based program showing a reduction in suicide attempts. The program is often presented during middle school and high school health classes. In the last year, that amounted to more than 1,000 presentations. Almost 22,000 students, teachers, and parents took part in the SOS program. The program leaves a big impact, seen almost immediately, with about 10% of students reaching out for help with their mental health. CHADS tells me that their program has helped decrease the rate of attempted suicide by 9.7%. Well, from the halls of area schools to the state capitol in Jefferson City, a local mother is turning tragedy into action.
I would encourage every teacher, anybody that deals with children, to take youth mental health first aid.
The push to get more teachers trained to spot the warning signs of suicide, next on Crisis at Home.